Hello and good evening, everybody. Um, Today we are here with a very, very special talk for mothers and children. But before we start that, I'd like to remind you that today is World Cancer Day. And we have a doctor here today with us who is not just going to talk about the cancer aspect of it, but about health, dental health for mothers and for children. And that is something that I think all of us are interested in. How many of you feel that as moms, you have to keep pestering your children to brush their teeth all the time? I do that all the time. I know they just don't want to brush their teeth. So, health, dental health with children, my God, I mean, any kind of help we can get is welcome, right? So, let me introduce the doctor who's going to come and help us. Um, Dr. Chirag Chamria, oral and maxillofacial surgeon. He's an oral and maxillofacial surgeon with Royal Dental. Royal Dental is a company that has clinics all over Mumbai, and Dr. Chirag Chamaria is the director there, and he also helps people who have oral cancer. This is the reason why I think today he's here to talk about dental health. Um, and he does not only maxillofacial surgery, he's also into zygomatic implants, cosmetic dentistry, orthognathic surgery, which is something I don't know about, so we'll definitely find out a little more about that. And he is a cancer specialist from Netherlands, Europe. So yes, he's a very, very qualified doctor, and we are happy to have him here, and we would love to have him on screen right away.
Hello,
Welcome,
hi,
doctor. Hi.
hello. Yes,
We are happy
so
to have you today.
thank you so much. I'm happy here. It would have been better if we would have this conversation in person, but we can't do anything. COVID is such.
Absolutely.
Yeah,
But
yeah.
hopefully we'll organize that soon too.
Sure. So,
Yeah.
before we start the talk, while I was just sitting here backstage and waiting for the talk to start, it just dawned
Huh.
on me that around 10 years back was the
Hmm.
first time where I attended a session wherein a doctor is giving talk, and it was done by my father in Mumbai at Sea Princess. It was for Rotary Club, and I was
Okay.
assisting him at that time with all the technicals and everything. And the crowd over there, the people over there were all 50, 55 plus. So the dental issues, so we prepared a whole presentation for him. It was like a 50
Hmm.
slide wherein we spoke about dentistry and we spoke about all of this. But we realized actually people over there had issues which were not even pertaining to the presentation. So then that is
Okay.
how it went organically. They had issues like, how do we take care of our missing teeth? Is it important to replace those teeth? So I think we'll orient the talk even today, taking inspiration from that talk, and we'll orient it to the people who are listening to it instead of me giving like a presentation of sorts. Will that
Sure,
be okay?
that would be great. That will
Perfect.
be great, actually. I think, or there are so many mothers online already, and I
Yeah.
think they do want to know, what you have to say, how
Yeah.
you can help them with not just theirs, but their children's dental health.
Perfect. So
Yeah.
see, first and foremost, we need to understand that children or adults, infants, or it may be even our parents and grandparents, all
Hmm.
have different needs. The
Okay.
different needs not only start at the level of how you care for your teeth at home, but it also
Hmm.
differs in terms of what kind of treatments or what kind of solutions will a dentist or a doctor will need to give. So for a
Okay.
very simple example,
Hmm.
um,
Hmm.
when do you think should a child be exposed to brushing habits, or at least their mothers start cleaning their teeth?
I suppose when they have a few teeth to clean.
So that is when we start, usually at 6 months of age. So when the child is at 6 months, the first teeth, the lower two teeth, will start to erupt. Even if they have not started, the child needs to get used to something in the mouth. So we use fingertips or we use a soft gauze to clean the mouth. So that is where we start from, first in the 6th month of age. So that is especially what is required. And then by the time we reach 6 years of age, we have all the milk teeth which have come, 20 in number. And then we start getting the permanent teeth into our mouth. So for a child, this is where we start our dental practice into. And when you look at mothers, when you look at
Hmm.
mothers, especially in those 9 months when a mother is conceiving, complete focus not only of the mother but the family is on the health of the child, is on the nutrition of the mother. In that case, we usually find that the dental health does get a little bit affected. There are a lot of issues which come during pregnancy and in the mouth, especially, you have heard of diabetes which happens during pregnancy. You might have heard of that there are certain other abnormalities which occur in the body. So I think she's disconnected. It is okay. So are we connected still? Yeah.
I'm here. I'm here. Yeah,
Okay.
we are connected.
Perfect.
Yes.
Right.
Yeah.
So what happens is, in for a mother, during those 9 months, especially in the second trimester, we find that it is the safest period to undergo any dental treatment. See, if you have pain, okay,
Hmm.
because of a deep cavity, you cannot defer the treatment. So now what we do is we use safe drugs which are safe for the child
Okay.
as well, and we can
Hmm.
undergo these, especially these emergency treatments. Okay,
Okay.
now I'll also be taking up questions in between. So one question
Hmm.
which I find here is, how many children these days? I find that many children these days don't lose their milk teeth. What is the reason for that? Okay, so let me tell you this: that an average age, okay, for your first permanent tooth to erupt is 6 years, but it is okay to be 1 year or 1.5 year late or early for that. So don't be alarmed
Okay.
by that. Second thing is, we will lose all the milk teeth by the age of 11 to 12 years. Now, how do we
Okay.
lose these milk teeth is that the permanent
Hmm.
teeth from below is going to start coming up, and that is going to absorb into or eat into the roots of your primary
Okay.
teeth or milk teeth. And then
Okay.
finally is what your milk teeth is going to drop off.
Okay.
Many a times what we find is that our child has a thumb sucking habit, okay, which is very common, or he is
Hmm.
using a bottle in the night. We
Okay.
find that because of that the jaw moves, the teeth, they tend to move ahead. because of
Ah,
that
yes.
reason because of
Hmm.
that reason, what happens is that the primary teeth get over retained, which means they stay in the mouth longer than what they're supposed to.
Okay. Okay.
Yes. Yes. Now what
Because
is
they
going to
made
happen?
place. Okay.
Correct,
Right. I get
for
it.
the permanent teeth to come. So what we
Right.
need to
Right.
do,
Okay.
correct. So what we need to do at that point is, we just take a small X-ray. Once a
Hmm.
year, when your child is going to go to a pediatric dentist, they will just take a
Hmm.
small X-ray to see, is the eruption cycle okay. If the eruption
Okay.
cycle is not okay, then even a smile, no, very minimal procedure of just correcting the habit of
Hmm.
thumb sucking, or correcting the habit of stopping the night bottle feeding which we
Hmm.
do, it would
Hmm.
more or less correct itself, because see, the child is growing at this point. Because they are
Right.
growing, there is a very high adaptability.
Okay.
Okay, so this is
Hmm.
where we come in terms of why a child doesn't lose their milk teeth on time.
Okay.
A minor extraction or something. Acha, there is also one thing which is very interesting. At
Huh.
the age of around 8 9 years, you will find
Hmm.
that your
Hmm.
child
Hmm.
teeth are just perfect. And then
Okay.
suddenly, when you reach that age of 8 or 9 years, you start
Hmm.
feeling, Are, my bacha ka child has started, the teeth have started to get crooked.
Okay.
There is this condition called, which is normal, it is called as ugly
Hmm.
duckling stage. Ugly
Okay.
duckling stage. So what
Okay.
happens is, both the canines, the upper two canines, they are very strong. So when they tend
Hmm.
to come, so before these two canines come, the front four teeth have already erupted in the mouth. When
Right.
these canines, they
Okay.
come down, okay, when they descend into the jaw, they tend to push on their incisors or the
The
front
rest
teeth.
of them.
है ना?
Okay.
Because of that, the front teeth get crooked and then they correct itself. So during this phase of 1.5, 2 years, no dental treatment should be done. And it is this age
Acha.
where most of the mothers or parents are concerned for their child. कि
So that's
अच्छा
that's
ये
that's actually a very big relief, because
yeah.
when they see the teeth getting crooked and run to the dentist, I think so it's okay to take it easy at that point, you're saying.
It is okay to take it easy, but best would be just consult whoever is your local dentist there, just for that
Okay.
one small examination, so that we know
Mm-hmm.
everything is okay. Okay, but this
Okay.
is a very
Right.
normal condition called as ugly duckling
Hmm.
stage, and everybody
Okay.
goes through it. Okay, so
Okay.
this is one
Hmm.
thing which was quite interesting.
Hmm. Hmm.
Then there is one question where it is about grinding of teeth. Okay,
Hmm.
so see what happens is this grinding of teeth can start
Hmm.
at any age. In
Hmm.
more or less, it is related to stress. Now
Hmm.
stress can be any type. It may be a physical stress, it may be a mental stress. In
Hmm.
adults, usually we see it is due to the mental stress, work pressures,
Hmm.
family pressures, any emotional trauma. We tend
Hmm.
to bottle up all the stress over here in these muscles. Then in the night when
Correct.
we go to sleep, it is where this stress is released and we tend to grind our teeth. So that
Okay.
is what happens in an adult. In an adult, what would it result into? In an adult, it would result into wearing off of the teeth. The teeth would get worn off faster. Whereas in a
Okay.
child, when this night
Hmm.
grinding happens, the child
Hmm.
tends to get severe pain in the jaw because their
Oh.
bone is
Okay.
softer. Instead of
Hmm.
wearing off the teeth, they tend to get pain, and this
Okay.
pain would result and this pain would result in probably a misdiagnosis where a small cavity would convert into a root canal or something like that. So we need to be careful.
Oh.
For a child,
Hmm. Hmm.
he or she, they are going to be growing at this time. Because they are
Hmm.
growing, there are a lot of other pressures which they are facing, which as adults we
Hmm.
probably forget. So we need to be
Hmm.
that emotionally sensitive toward a child, that okay,
Right.
he might just be learning how to do mathematics, how to just do multiplication, but that may
Hmm.
seem overwhelming to your child. So we need to be careful of that aspect. Just be okay,
Okay.
we can shout at them, but just be a little
Hmm.
considerate as well. So that is very important.
Okay.
It does affect the jaw also. Then there is
Okay.
one question. It's very nice. I'm getting a lot of questions. Interesting. Okay, how early age can a child be suggested for a root canal? Okay, so I'll
Hmm.
just give you a brief of root canal. What does a root canal treatment mean? When an
Hmm.
infection starts, it touches the
Hmm.
top layer of the teeth, which is called enamel. Slowly, it is
Yes.
going to go down. It goes to the
Okay.
first layer enamel, then the second layer dentine, and the third layer called as the pulp. As soon as it
Okay.
reaches the pulp, now this is true
Hmm.
for both
Hmm.
milk teeth as well as permanent teeth.
Okay.
Now, milk teeth are going to be staying in the mouth for probably less than a decade.
Hmm. Hmm. Hmm.
Okay. Now,
Okay. Okay.
yeah. So when it is going to be less than a decade, many would think
Hmm.
that, why think about filling or root canal?
Hmm.
Leave it. But no, it is
Okay.
important.
Hmm.
Why? Because it is this primary tooth which provides
Hmm.
the space for the primary teeth, for the permanent teeth to come. So
Permanent
it is
teeth. Right.
important that
Okay.
if a child gets a deep cavity anywhere,
Hmm.
one, we
Hmm.
identify why that cavity has come and look at the causative factors. I'll enlist few
Okay.
of them so that our audience is aware of it. And second
Okay.
thing is, we need to be aware that once that has happened, we need to correct it,
Hmm.
which is very important
Okay.
even for primary teeth. So a child can be probably 2 years old requiring
Hmm.
root canal. They can even be 1.5 year old. I personally have
Okay.
seen a child who's just crossed 1 year and we had to treat. Now it is difficult for these children at 1 year, one
Hmm.
and a half year to comprehend what is happening to them. So we
Right.
usually put them under
Hmm.
anesthesia. Now the
Hmm.
anesthesias are very safe.
Okay.
Okay, we put the
Okay.
child under
Okay.
anesthesia. It takes a couple of hours and we can get all of
Hmm.
these treated. So I think there is one
Okay.
question wherein is it okay to perform root canal on
Hmm.
3-year-old child? Yes, if it
Hmm.
is indicated, we should perform it because ultimately what we
Okay.
are doing is we are saving their permanent teeth. Now
Okay.
there is one question which comes on. My 10-year-old is grinding the teeth. It is very common.
Right.
Like I told you,
Hmm.
when the canines
Hmm.
are erupting, it is
Hmm.
at that point that the whole balance of the jaw is getting off. Because
Right.
of the whole balance getting off, especially
Hmm.
these 2.5 years. It
Hmm.
takes
Hmm.
time.
Hmm.
The child may grind the teeth.
Hmm.
Don't worry about it. Just
Hmm.
have a look at it. And the
Okay.
habit should go away by the age of around 12 when the canines have erupted.
Okay. Okay.
It is a self-correcting thing. We need not be worried about that. Uh,
Okay. Apart from you're saying going to the local dentist and just making sure it's all okay.
Yes. You
That's
see, for
the
children,
minimum
we
we
have
can
a
do.
yeah, yeah. So for
Hmm.
children, we have a special branch
Hmm.
of dentistry, which is a pediatric dentist. So
Correct.
pediatric dentists, the
Hmm.
major difference between your dentists who are practicing adult dentistry and dentists
Hmm.
who practice pediatric dentistry is the amount of
Hmm.
patience they have. For a
Okay.
pediatric dentist, they will have extreme amount of patience because it takes time. A child,
Yeah.
they're very intelligent and they are very
Hmm.
curious.
Hmm.
So
Right.
so it is very interesting. When I was in college, so we used to be taught
Hmm.
how to deal with a child. So there used to be a lot
Okay.
of theories and all of that, and we used to
Hmm.
actually hand the child our the air which we put, the micromotor, the drill which we use. We used
Hmm.
to give
Hmm.
that to
Hmm.
the child to play with it for half an hour, 1 hour. So it is
Okay.
important. I have
Okay.
seen pediatric dentists work, and a child is 5 or 6 year old, and
Hmm.
they're so cooperative. Even an adult won't be cooperative. So that is why we
Hmm.
have this
Hmm.
special field of pediatric dentistry. They're very patient. They know how to handle a child. So in case you
Okay.
feel that okay, my child requires treatment,
Hmm.
a special field is there. Let's go to them.
Okay.
Now there is one question which I am getting is I am nowadays getting food is getting stuck, I think, between my teeth on my left side, and
Hmm.
it's irritating.
Hmm.
Okay,
Hmm.
so uh, what do you suggest about tooth implanting? I think it's a continuing question. Okay, so
Hmm.
we understood how a cavity progresses into infection and then root canals, but in
Right.
dentistry there is
Hmm.
a second way where a teeth can also spoil, that is through the
Hmm.
supporting structures or the gums. So what
Okay.
happens is sometimes the
Hmm.
bacterial activity will not happen on the teeth, but it will happen around the teeth. Because of
Okay.
this bacterial activity, we'll have inflammation in the gums or swelling in the gums. As soon
Hmm.
as we start getting this swelling in the gums, that
Hmm.
particular bacterial activity will start damaging the bone,
Okay.
and it will cause our gums to go down or recede and our bone to get spoiled. That is how our teeth would
Okay.
start to shake ultimately.
Shake. Hmm. Hmm.
Okay, this is now
Okay.
I'm talking about why does a tooth shake. Now, when this
Okay.
happens, what is the
Hmm.
first sign of that? The first sign of that is food will start to get stuck between two teeth. Why? Because now the bone has gone down.
And the
So if
space
you
has
are
been created. Okay. Hmm.
yes, and that space is being created. So in that
Hmm.
case, what we need to do first and foremost is stop this activity of our
Hmm.
gums or bone receding. Second
Okay.
thing is whatever space has been created, either if
Hmm.
it is irritating, so we get that filled. Now that filling is not going to be a normal filling. We
Hmm.
probably need to cap it or crown it. That would be
Okay.
what will be required in that case.
Okay. Okay.
Or we can just simply take and maintain that space using our brushing techniques. I will
Okay.
discuss something on brushing technique also, because for a child
Okay.
it is different, for adult it is
Very
different,
useful.
for an elderly also
Okay.
it is different. But I'll take
Okay.
this about something about dental implant.
Hmm.
Why does it take 6 months for a dental implant? Okay. See, basically, whenever we place a dental implant, what is a dental implant? Dental implant is
Hmm.
nothing but a screw which
Hmm.
replaces the root
Root.
of the teeth.
Hmm. Hmm.
Okay, so if you
Correct.
have
Yes.
if
Hmm.
you have root structure in your mouth, then you don't need an
Hmm.
implant. But if you have lost
Okay.
your root due to extraction or teeth moving or whatever reason, then you would
Hmm.
require an implant. So
Hmm.
traditionally, what we used to do was we used to cut into the gums, look at the bone,
Hmm.
place an implant, then stitch the gums.
Okay.
When we used to do that, we had to wait for the gums to heal. After we
Okay.
wait for the gums, After we wait for the gums to heal, which is another 1.5 month, then we
Hmm.
had to wait for the bone to consolidate, because after 1.5 month, the bone is going to get a little weak in that area.
Okay.
Hence, we had to wait for 3 to 6 months. But now, what we do is instead of cutting
Hmm.
into the gums, we
Hmm.
simply drill through the gums. So there are no
Okay.
stitches which are required. Because we
Okay.
don't require any stitches, the
Hmm.
amount of anesthesia required is also less. The amount of
Less.
pain post treatment is negligible, and you
Okay.
can give teeth in the same sitting as well. So
Okay.
now we don't have to wait for 3 months, 6 months, 1 year to get the teeth.
Okay.
Okay, so this
Okay.
is important for us. Key dental
Hmm.
implants. Previously, yes, we required 6 months, 3 months of time, but now we don't
Hmm.
require that.
Don't need.
Okay.
Okay.
Now there
Okay.
was one. I think I answered that. Now there was one question which came about should my child brush after every meal? No, don't get excessive brushing. Now let's discuss about brushing. Just we'll go about that.
Yes. Yes.
So,
Absolutely. Yes.
see, first we'll talk about the toothpaste which we use.
Okay.
Your regular toothpaste which is there, which we use
Hmm.
as adults, it may be any brand, Colgate, Pepsodent,
Hmm.
Septodent, it may be Patanjali also. They all
Hmm.
contain basic 4 5 components. You may call it herbal, but
Okay.
the function remains same.
The same.
First
Yeah.
is to remove whatever debris is there. That is called an abrasive. Second
Okay.
is to provide that fresh breath where you get mint,
Hmm.
methanol, whatever it may be.
Hmm.
The
Hmm. Hmm.
third
Correct.
component is the fluoride in it. So fluoride, what it does, it forms a protective layer over our teeth, such
Hmm.
that the acidic activity of the food and bacteria that gets reduced. So these are the
Okay.
fundamental things which are present in all toothpaste. Then we have
Hmm. Hmm.
medicated
Hmm.
toothpaste, which are special products which are used where they may have some component which are added for sensitivity, or some component
Hmm.
which are added to give better whitening. Those are special
Okay.
cases. But in general, we'll have these
Okay.
three. Now, this fluoride component is very important.
Okay.
So for our child, at least
Hmm.
till they have gained their first level of maturity,
Hmm.
that is till
Hmm.
teenage, we need to use that
Okay.
child toothpaste. It
Okay.
contains half the amount of fluoride. To be
Okay.
precise, around 225 uh, parts per million of fluoride is what it contains. Because
Okay.
you cannot control a 2 year child that he or
Hmm.
she will spit the whole toothpaste. Some amount of
Agreed.
toothpaste will be taken in. And
Right.
this fluoride, if taken in excess, can cause brittleness of bone. So we don't
Okay.
want to get
Okay.
into that. It's going to happen if you do it every day. Once a while
Hmm.
is
Hmm.
okay. So that is why
Okay.
get into a
Hmm.
habit of buying the pediatric or the child toothpaste. It is specially
Hmm.
given before 2 years of age, 2 to 5, 5 to 11,
Hmm.
and then 12
Hmm.
plus, which is the adulthood.
Right.
So this is
Okay.
about our toothpaste. Next comes the
Okay.
brushing. When we
Hmm.
start with a child who doesn't have teeth or who has few teeth, now I'm talking about
Hmm.
probably less than 1 year of age, use finger
Okay.
or soft gauze to brush.
Okay.
Your finger
You
or
you know you get you also get those silicone things that you
yes,
can put on
that
your
is also
finger. Yes.
perfect. That is
Yes.
also okay.
Yeah.
Then
Okay. Okay.
once they start getting the primary teeth, once they have
Hmm.
the set of teeth, get into the
Hmm.
habit of the child brushing itself. They are just going to
Okay.
brush like this, it's okay, because in
Okay. Hmm.
children all the teeth
Hmm.
will have gaps in them. So
Okay.
get the child used to brushing. It's okay even if they're
Okay.
not brushing properly. Let We
Okay.
brush twice a day. Let the child brush twice, once in the morning, once
Hmm.
in the evening. Probably let
Hmm.
the child enjoy his brushing in the evening. And in the morning,
Hmm.
you are also in a hurry, you can just finish it off for him or her. As soon
Okay.
as they start growing more, this at
Hmm.
the age of 6 or 7 years, that is the
Hmm.
time where you teach your child that they need to start brushing in a circular way.
Hmm.
This
Okay.
circular way is the point where now your child will start to become more sensitive about that my teeth are turning yellow. Why? Because at this point they are having to go in the school, they are going to meet all their friends.
Others.
So at this
Yes.
point they will
Yes.
notice, acha, my teeth are yellower than my friends.
Hmm.
Okay, so at this time you
Right.
can teach them
Absolutely.
that they need to start
Hmm.
brushing in a circular fashion.
Hmm.
They need to start brushing
Absolutely.
the inner surfaces also of the teeth. So if I look at this,
Hmm.
this is my lower jaw
Hmm.
model. They need to brush
Hmm.
this area as well.
Right.
This is true for adults also.
Also.
And
Right.
then when we are probably in a teenage, late teenage, and this goes on for our life, we need to
Hmm.
make sure that all the surfaces of the teeth are touched.
Hmm.
We
Hmm.
touch all the surfaces of the teeth. In fact,
Hmm.
in adults, what we find? That they start
Hmm.
brushing excess and they create damages on their teeth. So don't do that.
Oh,
The brush
okay.
just needs to touch once, and that is more than enough.
Oh, really?
On
Okay. That's in.
every surface, it needs to touch once.
Hmm.
That is more than
Okay.
enough. So I think I've given you a brief of how brushing technique works. Now we
Yes.
come across how many times twice a day more than enough. Is
Hmm.
flossing good for teeth? See, if you're going to be able to do it regularly, good.
Hmm.
Um, Especially in adults, yes, it is good. But for
Hmm.
children, just to get them into a habit, it is okay. But they don't require a lot of flossing.
Okay.
Is there a natural remedy for yellow teeth? Okay. Now, what happens with yellow teeth? There are two
Hmm.
ways why a tooth can get
Hmm.
yellow. Okay.
Hmm.
One is that there is a layer which is deposited on the tooth because of faulty
Hmm.
brushing habit, or there are interpersonal differences also. Some would get a
Hmm.
whiter, some would get white tongue, some would get gum issues, some would get the
Hmm.
plaque over the teeth. So if it is
Hmm.
due to plaque, then we need to
Hmm.
improve on the brushing habit. That is the most important
Okay.
thing.
Okay.
Second thing is, it could also be due to excessive brushing. Like I told
Oh,
you,
okay. Hmm.
adults usually we find that they do excessive brushing. So the
Hmm.
top layer of the teeth, which is called enamel, it is white in color. But as soon as we
Right.
start brushing it, the second
Hmm.
layer, dentine, it is yellow in color. Now, as
Okay.
soon as you reach dentine, you cannot reverse it. You cannot get rid of
Oh.
that yellowness. You can bleach it. There are ways to do that. But again,
Hmm.
bleaching, then it would have a side effect of causing sensitivity. So that
Hmm.
is
Hmm.
something which we need to discuss with your dentist, that is bleaching a
Okay.
good option for you or not. But
Hmm.
yellow
Hmm.
teeth could be due to these two reasons. So if it
So
is due
can
to
the
plaque,
person get back their enamel if they've
no, enamel
supposing they've
doesn't get,
reached
no.
doesn't come back? Oh my
Enamel
God.
doesn't come
Okay.
back. But what happens
Okay.
is, our
Hmm.
body is made in such a way that,
Hmm.
say, for example, the topmost layer, the outer part of
Hmm.
our teeth, and the nerve
Hmm.
is, say, 1.2 mm away from each other, and we wear off
Okay.
the topmost part.
Hmm.
Then,
Hmm.
slowly, in a matter of 4 to 6 weeks, the
Hmm.
nerve part, the pulp part, will shrink down. But it takes
Okay.
around 6 weeks. So, our body manages that. That is why
Hmm.
always
Hmm.
the distance will be the same, but you cannot
Okay.
get back that
Okay.
white layer again. No, it is, then we'll have to bleach it only.
Okay. Okay.
Okay.
So which means
Now,
overbrushing is a very bad idea.
yeah, it is a very bad idea. And it
Very
is,
bad idea.
believe me, we see patients more often
Huh.
getting problem due to overbrushing rather than
Huh.
underbrushing. So that is
Okay.
more of. Then
Okay.
I read somewhere, I think it was there, ki how do we get rid of tartar by
Hmm.
self? So see,
Yes.
tartar
Yes.
is actually nothing but the soft plaque which has
Hmm.
become consolidated.
Hmm.
In an On an average, it takes 14 days for this soft plaque to become consolidated into a thick yellow structure which you cannot remove. It takes 14
Okay.
days. But there are some
Okay.
people for
Hmm.
which it would happen within 7 days, and there would be some
Okay.
in which it takes 1 month for that to happen. So
Okay.
those are certain interpersonal thing. Especially you would see
Hmm.
in this lower teeth over
Hmm.
here where a lot of
Hmm.
plaque gets accumulated.
Okay.
Okay, so in
Okay.
that sense, if a person is getting a lot of plaque or tartar accumulation,
Hmm.
one, be regular with your brushing and make sure you clean all the surfaces of the teeth. And
Hmm.
second, it is something which you have to live with. These are certain interpersonal variations which are there, and you will
Hmm.
have to get, instead of a regular cleaning once or twice a year, you might have
Hmm.
to start doing it every 4 or 5 months. So that is the issue,
Hmm. Hmm.
because prevention will be less invasive, cheaper, less time consuming, less painful. It is always
Definitely.
better. So,
Yeah. Yeah.
no, you cannot remove tartar at home. It will cause you
Hmm.
more trouble. So,
Hmm.
better if you find that you're getting a lot of tartar, we visit a dentist. How old
Okay.
should my child be for visit to the first dentist? 6 months to 1 year is the first average age which we
Really?
get. Yeah, ideally.
Okay. Okay.
In India
Okay.
it is still not common, but we'll see as
No,
new
it's not.
generation parents,
Hmm.
as new
Hmm.
generation parents would come, even gynacs will start recommending. Now we have seen a lot of gynacs and dental are getting, close to each other because of the same
Hmm.
reason, because mother requires
Hmm.
a lot of care and then the child requires care immediately after 6 months. So a lot of pediatricians
So
and
right.
yeah,
So because you're saying now gynacs will recommend it, this is a question that has been in my mind. Um, I know that during pregnancy, mothers face issues. I mean, they have
yeah,
bleeding gums and stuff. So
yeah,
what can be done to prevent that? It's very difficult to manage during
yeah,
pregnancy
yeah.
because you feel medicine nahi lena hai because
Correct. So
avoid as much
ekdam
as you can. So yeah,
perfect, perfect. So see
yeah.
what happens is during so for a now there is a difference between the male and the female. Female
Hmm.
body is protected by their hormones, okay,
Okay.
which males
Hmm.
are not. So females have progesterone and estrogen hormones which protect every part of their body, the bones and everything. During
Okay.
pregnancy, these fluctuations come in the hormonal levels. One of
Okay.
the effects on that is on your teeth.
Hmm.
The
Hmm.
other most common effect is thyroid and diabetes, which is very common. So you have
Okay.
pregnancy induced hypothyroidism, wherein we say thyroid has come, and the other is
Hmm.
diabetes, which comes during
Hmm.
pregnancy. It mostly settles after that, but it is at this
Hmm.
point. Now,
Hmm.
all these three factors with hormonal changes causes
Hmm.
swelling in the gums.
Okay. Okay.
One. Second,
Hmm.
uh, I think a recent study was conducted by the American Dental Association wherein they said
Hmm.
around 18% mothers don't brush in the morning. Mothers, as in who are conceiving right now, they don't brush in the morning because of that morning sickness which is there.
Right.
So
Oh, okay.
again, that is
Hmm.
creating an issue. 18% is a big number. 1/5 of the
Yes.
population doesn't do that.
Right. Right.
So
Right.
that is another
Absolutely. Hmm.
reason. So what happens
Hmm.
is at this point, see, in first trimester and the third
Hmm.
trimester, as
Hmm.
dentists we don't like to do much, but second
Okay.
trimester is the safest.
Right.
So
You
if a
said that.
mother
Yes.
has pain, if a
Hmm.
mother
Hmm.
has gum swelling, gum inflammation,
Hmm.
it is
Hmm.
important to get it treated in the second trimester.
Hmm. Hmm. Okay.
And
Okay.
suppose if 9 months are now
Hmm.
over, we have
Hmm.
done, and we have some problem in the gums, which for
Hmm.
any number of reasons we avoided going to the dentist. No
Hmm.
worries. As soon
Hmm.
as our 9 months are done, we should
Hmm.
immediately visit the dentist, because at this point it is still more or less reversible.
Okay.
We usually
Okay.
see female at the age of 42 to 48, where
Okay.
most of their teeth have started to shake, and they
Okay.
really shake it. Yeah, most of their teeth have started to shake. And when
Hmm.
asked that when did it start, it was during their second pregnancy, not the first pregnancy, second pregnancy, at
Okay.
the age of around
Okay.
33, 34. I don't
Okay.
have any study to back this up, but this is what we have
Hmm.
observed. So
Okay.
this is something we need to take care of, because in pregnancy
Hmm.
gum
Hmm.
swelling happens, bleeding gums happen. No need to get alarmed. Brush well, keep
Hmm.
it clean.
Hmm.
If you don't want to brush in the morning, use a blander toothpaste instead of getting those flavored ones. Use the bland ones.
Hmm.
You get them
Okay.
of all the brands, you get them, use the bland ones. There is not going to be any taste in it.
Okay.
Is the
Okay.
Yeah, that will be better.
Hmm.
There is one question which comes: is the age-old practice of cleaning teeth with lemon and salt still advisable? The same
Hmm.
components are there in your toothpaste,
Toothpaste as
so
well.
why go for
Hmm.
the same thing? See, lemon
Hmm.
provides the acid, okay, that is to clean the surface, and salt is an abrasive. Same thing is present in your toothpaste as well. It is more hygienic to do that with lesser side effects, because you don't know what is the concentration of lemon acids which is
Hmm.
there, so it is better
Hmm.
to
Hmm.
use your standard toothpaste which are available. What happens if
So
the root please
yeah,
ask.
no, I still had some more questions. Since we were
Yeah.
talking about mother's health and a pregnancy, what about lactating mothers? Do they have issues because do they lose calcium while they are feeding the child? Does
No,
that
no,
affect their teeth? No,
no,
that's
no,
that's completely
no.
a myth.
That's
Okay,
completely.
okay, okay.
In fact, our body is made in such a way that
Hmm.
we have a lot of calcium in our
Okay,
body. We always store excess of calcium, excess of phosphates, by which our bone is made.
okay, Okay.
When a lactating mother, they
Hmm.
will not lose calcium per se, okay, but
Hmm.
they could feel
Hmm.
weak, and that is like supplements of calcium and vitamins are given to lactating mothers. But there is
Okay.
no relation between that. You cannot do a dental treatment for a lactating mother. No, there is no
No,
contraindication,
you correct,
because
correct.
the
Hmm.
medications which are now available, they don't
Hmm.
pass on to the baby, so we are very
The
safe
baby.
in
Hmm.
that consideration.
Hmm.
So that is more or less
Okay.
okay.
Okay. Um, Also, since mother and child dental health we're talking about, when the child has dental issues, does it also affect their overall health?
Yes. So we have observed that what happens is, so I'll give you
Hmm.
one very good example. There is something called as
Hmm.
early childhood caries. Okay, it's a technical
Okay.
term.
Hmm.
Early childhood
Hmm.
caries usually
Okay.
happens when the mothers start to wean off their children from breast milk. So how
Okay.
does regular most of the mothers, what they do is, while
Hmm.
weaning off, they would
Hmm.
give a sipper or a bottle full of milk
Correct.
to the child at
Correct.
night. Now,
Hmm.
once that is done, now milk, very high content of sugar, it is going to be
Hmm.
there in the mouth for an extended period of time, 2, 3, 4 hours. This
Right.
is a perfect, or it's a perfect recipe for getting the child into early childhood caries. You would find that the
Okay.
child's front few teeth have started to
Hmm.
turn black and they've started to become smaller. The child at
Okay.
that age, 2, 2.5 year
Hmm.
old child, will not
Hmm.
exactly be able to communicate that they're getting pain. They
Hmm.
would just be communicating that I am feeling uncomfortable, one.
Hmm.
And
Hmm.
yes, we do find that the child
Hmm.
gets fever, a child becomes nauseated, their diet
Hmm.
reduces, their overall health reduces, because
Hmm.
they're not able to eat well, and whatever they
Hmm.
eat, that gives
Hmm.
them pain.
Okay.
So
Okay.
so this is very important that,
Hmm.
first, to this bottle feeding, we need to control that. We may feed
Hmm.
with the bottle, but it cannot
Hmm.
stay for an extended period of time. You should
Right.
not keep it in the night. uh,
Hmm.
there are other ways to wean off the child.
Okay.
Instead of keeping a
Okay.
sugar, I know it becomes very troublesome for the mother, because they are working, and then in the evening the child is not sleeping, but this is something which
Right.
would spoil their health for the life. So this is something which
Right.
we should
We
avoid.
really need to look up. Right.
Yeah,
Right.
yeah, this is
Okay.
something we need to avoid. Yeah.
Okay. Okay.
So then there was one question which was coming, wherein what happens if root canal
Hmm.
for a 3-year-old is left untreated?
Hmm.
Okay. So 3-year-old means we're talking about milk teeth. Now,
Hmm.
when we're talking about milk teeth, there is a deep cavity there. That cavity has
Hmm.
proceeded to infect the nerves or the blood
Hmm.
vessels, and that is why
Right.
doctor had recommended root canal. And
Right.
if we don't do that, what is going to happen?
Hmm.
Slowly, slowly, that infection is going to go inside the tooth
Hmm.
and start going around the bone area as well. Now, for a child,
Okay.
their immune system is strong enough to fight most of these infections,
Hmm.
but the bone is very soft. So what it will do is, because now the swelling has gone inside the bone, the infection has gone inside the bone, it is going to displace the permanent teeth which are inside, budding inside the natural bone. So this is where
Okay.
one more reason we would find that now the child is getting the permanent teeth in an abnormal position, which was your first question. This is another
Okay.
reason.
Okay.
So
Okay.
it should not be left untreated. You should get it
Hmm.
treated. Get rid
Hmm.
of the infected pulp. Get rid of the uh, uh, all the debris which is there, and
Hmm.
get a pediatric crown over it. That would
Okay.
it would be
That is
as
not
though
a
it is
permanent
natural.
thing.
Yeah, it would
Hmm.
work as though it is a natural tooth.
Okay. Okay. So that's possible.
That is
So there
possible.
is another question here that says, what should we not do to keep our teeth healthy?
What should we not do to, okay, so things which we should avoid at all times. So first
Hmm.
is, see, we've all heard, whenever we hear about nutrition and diet, we hear about,
Hmm.
there should be 3 4 meals which are paced properly during the day. It
Hmm.
is not only for the diet, but it is also for your oral health. So there is a concept called as 4 meal exposures. So if you
Hmm.
visit a pediatric dentist, what they would do is, when they are talking to you, they would ask, "Acha, what is the diet of your child? At what time does your child eat? Is there in between
Okay.
snacking?" This is
Hmm.
true even for child, it is true for adults, even
Adults. Hmm.
elderly
Hmm.
also. So
Okay.
on an average, four exposures of sugar. So
Hmm.
sugar would mean anything from rice to chapatis to milk to chocolates to any snacks.
Okay.
Four meals
Okay.
our body or teeth can compensate it for. So if you remember that Happydent ad which used to come, which used to be like, when you eat food, the pH of the mouth reduces, and then when you eat Happydent, the pH increases. It is partially
Yes.
true. It is partially
Huh.
true.
Okay.
As
Okay.
soon as we eat, the pH reduces, but
Hmm.
till 4 times in a day on an average, our body
Hmm.
by itself can get the pH up. But in these
Okay.
in between snackings, when we
Hmm.
do, the body is
Hmm.
not able to get the pH up.
Okay.
So, one, either avoid in between snacking, or make sure
Okay.
that after doing in between snacking, the pH of the mouth comes back to the normal or the alkaline stage. How would you do that? Any green
Happy
leaf
dent.
products, Happy Dent, chewing gums, one option.
Yes.
So
Huh. Okay.
any
Okay.
green leafy vegetable which we take,
Okay.
that would help. Okay,
So
like
you're saying
soft
you
is
can
one.
chew a mint leaf and then that'll help?
Mint leaf would work. Soft would work.
Okay.
Um,
Okay.
uh, uh, Ground nuts would work. They
Okay.
all tend to increase the pH of the mouth. And once they tend to
Okay.
increase the pH of the mouth, it works well.
Hmm.
So even if your child wants to eat a chocolate, in fact, we do that a lot of times when a child comes,
Hmm.
they're scared.
Hmm.
So you know what we
Hmm.
tell for the first time we tell them is, you have to eat chocolates. You should eat chocolates. There is no harm in eating
Hmm.
chocolates. But
Hmm.
what you
Hmm.
should
Hmm.
do after that is, you
Hmm.
should eat these badam, pistas, you should eat almonds, you should eat soft. Automatically, now
Hmm.
child, most of the children don't like these food. So the
Hmm.
amount of sugar which they consume also reduces. Also, the teeth
Hmm.
gets protected.
Right.
So this is another way where, this is one thing which you should avoid, is multiple food exposures.
Right.
Second thing, it's a very common practice in the Asian countries, where
Hmm.
they tend to eat brush in the night, and they have a very good logic for that. That during the
Hmm.
whole day we are working, and that is why we accumulate a lot of dirt, and that is why we
Hmm.
need to brush in the night and not in the morning.
Okay. Huh.
What happens is,
Hmm.
see, during the day you are eating food, so there is
Hmm.
continuous, we are talking, there is continuous movement of saliva. Our
Right.
saliva is a very good healer. Okay, it
Correct.
heals a lot
Hmm.
of
Hmm.
stuff in the mouth. So
Hmm.
because of that, what happens during the day, our body,
Hmm.
those four exposure, it can manage. In the
Manage.
night, for
Correct.
that 6 to 8 hours, there is no
Hmm.
movement or very minimal movement of spit or saliva. The whole
Correct.
area becomes moist and warm. It
Right.
is very good for the bacteria to incubate or grow.
Bacteria.
Okay, and as
Absolutely.
that is why in
Ab-
the morning you would find you have bad breath. During the day you may
Right.
not find it, but in the morning you will always find it. It is because
Right.
of that.
Right.
Now the
Absolutely.
bacteria have been accumulated, they release those gases, and that
Hmm.
is why
Hmm.
this bad breath happens, and that is why we need to brush in the morning. The logic of night
Right.
brushing is good, it is perfect, but you cannot avoid the morning brushing. It needs to
But
be
is it
done.
okay to brush after breakfast? Because that was another question. Is it okay to have
Yeah.
breakfast first and then brush?
Okay, so now what happens is,
Hmm.
what are we trying to do? We are trying to
Hmm.
reduce the bacterial load in the mouth. Okay.
Right.
Now,
Right.
will that half an hour of eating? So the concept is not, is it after breakfast? The
Hmm.
the idea is
Hmm.
not that. The idea is,
Hmm.
after waking up, do you
Hmm.
want to spend that half an hour, 1 hour more with that bacterial load in your mouth or not?
Ah.
Okay,
Crucial
so
question. Right. Hmm.
yeah, so the point is
Hmm.
that, so
Hmm.
there is no harm in eating breakfast before brushing,
Hmm.
but now what is happening? Already we have a lot of bacterial load. We are
Hmm.
going to be taking that bacterial load in our body. Although the
Hmm.
amount of bacterial load is very low for a normal healthy person to get affected, and hence
Okay.
this concept, okay, I will eat breakfast first and then brush.
Hmm.
Technically it is just that 1 hour, half an hour which we are dealing of brushing. So it is the concept of eating before brushing is
Hmm.
not bad, it is not right, it is not wrong, it is just
Hmm.
that, do we want to waste that 1 hour before we clean our teeth? So that is
Okay.
actually the question which should come in our mind.
So according to you, as soon as we wake up, the best thing to do is brush your teeth
Best.
without
Because
wasting any time.
yeah, you should get rid of whatever dirt has been accumulated, right? So,
Right.
our
So,
children come home after playing. We tell them, go
hmm,
to the shower, go take a shower
wash
first.
up.
You are
Yes.
smelling. Why
Absolutely.
do we do that?
Absolutely.
In
Hmm.
old Indian times, whenever people used to be there, before entering the house, they used to wash
Hmm.
their hand and feet and then enter the house. We have
Right.
started to follow
Absolutely.
that now because of COVID, but the
COVID. Yes.
traditional old techniques were the same. Why? Because you don't want to get anything which is not required, all these harmful bacteria. You don't want to get into them. Yeah.
Correct. Correct. Absolutely. There was another question that if a child is scared to visit the dentist, how do we
Yeah.
manage that?
So it is very common for a child to
Hmm.
visit any
Hmm.
doctor. So the
Hmm.
counseling starts from the parents itself. So
Hmm.
always, any child who's doing a little bit of mischief or they're not behaving in the way we want them to, it's a very
Hmm.
common line that either you do this or I'm going to take you to the doctor for an injection. It
Right.
starts from
Absolutely.
there. It starts from there.
Yes.
That
Yes.
needs to stop
True.
because the
Stop.
visit
I
to the
know.
doctor is very difficult for the parents. It is so
Correct.
troublesome because in that period of half an hour, 1 hour when you're going to travel, and then when
Hmm.
you're going to stay at the doctor's place for that half an hour, 1 hour, your child is just crying. It is very troublesome. It is very draining for the child as well as the parent. So one, that
Yeah. It's
line
a
needs
trouble
to
we've
stop.
created for ourselves.
That is
Yes.
for ourselves. So one, that line
Yes.
can
Yes.
stop. Second thing
Hmm.
is, when we go to the dentist, first time the child won't be scared. They would
Hmm.
be a little apprehensive, but the scared factor will not come. The scared
Hmm.
factor will come when they have a previous experience.
Right.
Now, that
Right.
experience could have been that they would have overheard their parents saying that, or they would have overheard their uncle or aunt saying that, Arey, I went to a dentist and I had pain. It could be just
Hmm.
that line which has that I will never go to a dentist. But in
Yeah.
that case,
Right.
settling with a dentist, meeting the dentist, and once we have
Hmm.
adjusted to the pediatric dentist environment, which the
Hmm.
pediatric dentists are more or less equipped to handle even a scared
Hmm.
child, it
Hmm.
should be okay. Just one time it will be difficult, then from subsequent visits it would
After
get
that,
easier.
it should not be.
Yeah, it would get
Right.
easier. Yeah,
Absolutely.
yeah.
Absolutely. Then there is another question that says, what is the kind of toothpaste we should use on a daily basis?
So non-medicated in an on an average, if I would look at 80% of the population, they can use any toothpaste of any brand which
Hmm.
contains fluorides in them.
Okay.
Now,
So,
which contains
hmm.
fluoride in them, fluoridated toothpaste. Now it could be your
Okay.
Pepsodent, it could be Colgate, it could be
Hmm.
Patanjali, it could be any other brand. There is no problem.
Hmm. Hmm. Hmm.
What happens is, say now the issue of sensitivity arises later on in
Hmm.
the age. So what we would do is we would shift you on a desensitizing toothpaste like Sensodyne. Now if
Right.
you have to visit or if you have a function in the house and
Hmm.
you say, I just
Hmm.
want an immediate solution of white teeth and I don't have time to go to the dentist, so what we would
Hmm.
suggest, okay, then what you do is just for today use the charcoal based toothpaste. So
Okay.
that what it would do is that would give you immediate gratification, that would give you immediate
Hmm.
whitening, but don't use it every day because anything which is immediate will also have certain effects to that. So a regular
Right.
thing will not be good, but there are
Correct.
indications for this. So
Hmm.
solution based toothpaste is perfect, what Tejal says.
Okay.
But on an
Okay.
average, we should be using fluoridated toothpaste for child based fluoridation, for an
Hmm.
adult toothpaste. That should be good enough.
Okay. So apart from a lot of other questions, one of the questions is, where are all your clinics located? So I think what we
So
can tell them is that, yeah, yeah, please.
yeah, so basically, see, we are located in Bombay. Okay,
Hmm.
we're located in Mumbai. We're located in the suburbs, Kandivali region.
Hmm.
But
Okay.
can a child get rest all? I think it can come on the chat itself, so that would be all right.
Right. We can
So there
put
was
details on the chat. Yes.
yeah, yeah.
Hmm.
After eating chocolate, can we just rinse the mouth with water? Not always. It will not help. Chocolates do get stuck between teeth. So better
Hmm.
is that we eat. There was one question about betel leaf as well. Now
Right.
it's a very
When we were
now
talking
it
about
is a
the green, yes.
correct, correct.
Yes.
Yes. So there are side effects to betel leaf and betel nut. But when
Hmm.
I'm only looking from the perspective of fluoridation, yes, betel leaf contains fluoride. But there are certain
Okay.
riders to it. Betel leaf
Hmm.
also contains alkaloids that can
Okay.
cause your mouth to start opening less. So,
Okay.
okay, that condition is called as fibrosis. So, if you
Okay.
see your cheeks, they are very soft from inside, right? The cheek mucosa,
Hmm.
which is soft, that tends to
Correct.
harden. So that is
Hmm.
the side
Hmm.
effect of betel leaf and betel nuts. But in
Okay.
terms of fluoridation, yes, betel leaf being green, it does
Hmm.
contain fluorides in it.
Hmm. Okay.
There was one question which
Okay.
is, can a child get dental implant?
Hmm.
Children usually don't require. We wait for the growth to happen. At least
Hmm.
16 years of age, they should have uh, acquired before getting into a dental implant. But in
Hmm.
certain cases, like accidents, we do the dental implants even as early as 13 or 14. But then they
Okay.
require change in the prosthetic part or the teeth part later as they grow. So till the age of
Okay.
probably 20 years, from 13 to
Hmm.
20, once or
Hmm.
twice we would have to change their teeth just to
Okay.
accommodate the growth which has happened. Um,
Okay.
though you don't have to brush after every meal, mouthwash,
Hmm.
yes. After every meal, you can just use a regular water for
Hmm.
clean
Hmm.
for
Hmm.
mouthwash, and that should be more than
Hmm.
enough.
Hmm.
No, not necessary to use a Listerine or a chlorhexidine based mouthwash every time.
Okay.
There was one question on bad breath as well. Some people
Hmm.
have bad breath all the time. It is very embarrassing. What should you do? See, okay,
Hmm.
so I'll do get into cancers as well, but let's just answer
Hmm.
this bad breath now. So
Hmm.
the reason why this bad breath happens, so if you
Hmm.
see after an
Hmm.
extended day of time, the
Hmm.
underarms, the crevices of the body, they do have a little bit of smell in them. Okay, that
Hmm.
smell is nothing but the odor which the bacterial activity has released.
Hmm.
That is
Okay.
what happens in our mouth as well. Now that bad breath
Okay.
happens, so bad breath happens because the gums have swollen up and we
Hmm.
are not able to clean our teeth properly because now the gums are swollen, and
Okay.
inside there the bacteria are trapped, and that causes a
Okay.
prolonged period of bad breath. Now
Okay.
if it happens to you yourself, you can
Hmm.
you because now you have this knowledge, you can go back to your
Hmm.
dentist and be like, okay, I have this bad breath issue, let's resolve this. But it does get
Hmm.
embarrassing for you to tell anyone else that you have a bad breath. So
Hmm.
this is something which is like a soft skill which is difficult, to answer. Yeah, yeah,
Absolutely. Absolutely.
yeah.
Yeah. Yeah.
There was something about cosmetic procedures. um,
Somebody was asking
See,
whether you do. Yeah. Yeah.
yeah, so there are two, three questions. One is same day cosmetic procedure. Is it good
Hmm.
for long run? Do you do cosmetic
Hmm.
procedures? See, ultimately, dentistry is both an art as well as a science.
Okay.
So when we study dentistry, there are three parts to it:
Hmm.
function, structure or stability, and aesthetics. What we
Aesthetics.
need to do
Okay.
as dentists is to achieve two
Hmm.
of them: function, stability, and aesthetics. If I
Hmm.
can get function and stability corrected,
Hmm.
aesthetics will come. If I can get the aesthetics and structure, functionality will come.
Okay.
So cosmetic procedures, just for the general public to understand, dentistry has
Hmm.
been divided into dental implants and cosmetics and all of that. But ultimately, we as dentists do only one thing, that is, from
Hmm.
these 3 points, try to get any two corrected, the third one
Two
automatically
will
results,
fall into place.
will
Correct.
fall
Okay.
into place. So that is where function, aesthetics. So if you have a missing tooth, our
Hmm.
ideology always remains the same, that is to get one or three out of these three, two corrected. So yes,
Okay.
cosmetic procedures can be done. Uh,
Do work. Okay.
because of the advances now in science, first we had to have many visits. The
Hmm.
treatments used to go on for months, but now that is not the
Hmm.
case. We can probably finish it off in one sitting itself. So that should not be an issue.
Okay.
There was one
So
question
it's
on.
easier. Hmm. Yeah.
Yeah, it's become easier. People have become busy.
Hmm.
Dentistry is not a priority. Always medical health should not be something which we need to look or think about it every day.
Correct.
So that is why it is better to it takes one day. Even if you don't have any teeth, to get the complete set, it would probably take around 5 to 6 hours. So it is better,
Okay.
just do it one day and then forget about it. Then you just have to visit
Hmm.
like once every 6 months or so, and then you are more or less sorted. It's like that.
Right.
So yeah. So there was one question about transparent braces.
Yes.
So see, ultimately, if your teeth are in an abnormal position, there
Hmm.
are two ways to correct it. Either you move the whole tooth into place,
Hmm.
or you make them appear to be in place. When you
Okay.
make them appear to be in place, then it is
Hmm.
called cosmetic dentistry.
Okay.
And when you physically move them into position, it is orthodontics.
Okay.
In orthodontics is basically wires and braces.
Hmm.
Now, there was an issue with wires and braces was that
Hmm.
silver color metal is something not everybody appreciates.
Right.
So, as an alternate to that,
Hmm.
transparent braces came into existence. The
Okay.
indications or the reason for doing transparent braces are same as that of going for wires and braces. The only
Okay.
difference is in the that issue that the silver braces should not be seen. That is the major
So the
difference.
material, so the material is different, but does it work as effectively?
There are indications for it now
Hmm.
because so see, this particular invisible braces started to get a lot of this activity around 4 or 5 years back.
Okay.
In the past 1 year, a lot of advancements have happened. So now more or
Okay.
less we can finish off 80-85% cases with invisible braces, which would otherwise require your traditional silver color braces which were there. So yeah,
Okay.
most of it can be done now, and it works.
So it
um,
works. So
yeah,
there
but
is
the
that
only issue is
advantage
it
of
takes,
it.
yeah, but
Hmm.
it is the only disadvantage is it takes time. 2.5 years is what it takes.
Okay.
So that is the biggest downside for those treatments.
Okay.
Otherwise, they're
That's a
fine. Yeah. Otherwise, they're fine.
okay.
Is it okay to remove wisdom
Okay.
teeth? So, we see that the wisdom teeth, they're called wisdom teeth, not because they give you wisdom, but they come at the age when a person is supposed to be a little mature. That is after the age of
Hmm.
18. We have seen
Hmm.
patients who get wisdom teeth
Hmm.
even at the age of 40, 50s.
Okay.
You can remove wisdom teeth at any age.
Hmm.
If we were in US today, if we were in
Hmm.
United States today, they would remove your wisdom teeth prophylactically. Prophylactically means they
Okay.
would remove the wisdom teeth even at the age of 18 or 20, even if it is not giving trouble. But in India, we
But
follow
why?
a lot of European concepts.
Hmm. Hmm.
Because we follow a lot of European concepts, we are very conservative in our approach. So we would only
Hmm.
remove a wisdom tooth in case it is giving trouble or it is supposed to give trouble in future. We can predict more or less very accurately in those. We would require X-rays, but that can be done. Yes. So age of 34, there is no age bar on removing the wisdom tooth or the last molar which is there. Why are dental
Okay.
treatments so expensive? Actually, in India, now I'll just give you some
Hmm.
insight. Yeah, they are expensive. Uh,
Hmm.
so when I compare India to the first world countries,
Hmm.
the dentistry would be probably 10 to 15 times cheaper. One. But
Okay.
when I
Okay.
compare it to other health professionals in India itself, when I look about
Hmm.
dentistry versus cardiosurgery, or dentistry versus gynecology, or dentistry versus pediatrics, dentistry turns
Hmm.
out to be more expensive. Uh,
Hmm.
Major reason what I feel, I'm not so sure on this, but what I feel is why is dentistry expensive is
Hmm.
over here it is not only the dentist or the doctor who's using their skill and knowledge, but there are a lot of materials which are coming in as well, lot of prosthetic work as well. That tends to
Hmm.
push up the cost. Second thing what tends
Right.
to push up the cost in dentistry is that dentistry is not like you do a surgery and then you forget it, you get your
Hmm.
appendix out and you forget it. Dentistry is
Hmm.
something where you need to again and again keep following up with your doctor. So we always tell our patients a very nice
Hmm.
analogy that
Hmm.
dentistry is like a car. You may buy
Hmm.
Maruti, you may buy Toyota, or you may buy a Rolls Royce. It needs to go for
Correct.
service every year.
Right.
So you
Right.
may buy. So this is what dentistry is about. Dentistry is not a one-time thing. There is a
Hmm.
continuous care which needs to be taken, where you and your dentist then form a bond, and that is
Okay.
how it goes.
Okay. So that's important, right? We need to form a bond with our
Yeah.
dentist, see them regularly. It's not just our
Regularly.
friends, it is also our dentist that we need to see regularly.
Yeah, we need to have.
Yeah. Right. Okay. So this has actually been such an enlightening conversation, Dr. Chirag. It has been
Yeah,
really, really informative. And I think the information has been very, very, very useful for mothers, especially, and
yeah.
for their children. So, yeah, we have one more question. Shall we just take that before
Sure,
we conclude? Should we have
sure.
a regular dentist visit for general hygiene and care? Yes, just what we were talking
Every
about,
six
right?
months. Every 6 months. So see, I'll just give you an example.
Hmm.
So I will not talk about specific practicing dentists. I will just talk about
Hmm.
dentistry in general at this point.
Right.
So when I'm talking
Right.
about dentistry in general, just a
Hmm.
regular visit to your dentist,
Hmm.
cleaning and balancing of your teeth, say
Hmm.
costs you 100 rupees. Okay,
Hmm.
this is not actual
Hmm.
figures, but 100
Hmm.
rupees.
Hmm.
This 100 rupees you would be spending probably every 6 months or every year.
Right.
Now you don't spend
Hmm.
this for 5 years.
Hmm. Okay.
Now 1,000 rupees is what you have saved.
Saved.
But in
Correct.
these 10 years or 5 years,
Hmm. Hmm.
there was a filling which was to be done, which
Hmm.
couldn't have been done because you did not visit. Now it has
Hmm.
progressed to a root canal with a cap.
Right.
Now this 5,000 has suddenly jumped up to
Hmm.
10,000. So your 100 rupee saving has created an immediate cost of 10, and it is actually like that. It is 100 times more expensive to get a root canal
Okay.
with a cap done. Now
Okay.
say you don't do this also, you wait for another 5 years. Now
Hmm.
that teeth
Hmm.
has broken off, that teeth has come out, that teeth has become absolutely spoiled. You have to
Hmm.
place a dental implant. Now
Hmm.
that 10,000 has become 50,000.
Oof. Okay.
So dentistry will be very so, but it is the time commitment. Once a year, it gets lazy for
Hmm.
anybody to go. So
Hmm.
it is always advisable, and we will find this in the newer generations because the children are getting much aware, because parents are
Hmm.
getting aware. See, as
Right.
our parents, when they were 65, 70, they are not
Hmm.
aware of these facts. They were not aware, so they
Hmm.
didn't take care much of their children in terms of dental health. Now as young mothers are coming, they are taking a lot of care for their children, so we will find these
Right.
dental issues to start reducing.
Right.
So
Absolutely.
yeah, so
Absolutely.
this is the analogy. So actually dentistry won't be expensive as time comes by, as time goes. We'll find that because we gaining more knowledge in this aspect as well.
Right. Absolutely. Absolutely. So that sounds very promising,
Yeah,
Yes. So it'll definitely encourage more people to go. And
yeah,
I think what you said earlier, that it's easier when you try to prevent something rather than go
correct,
for trying to fix
correct.
something that's already spoiled. So
Yeah,
not only is it easier, it's cheaper to prevent rather than to fix. So might
very,
as
very.
well,
It's easier for
yeah,
us
yeah.
also as dentists. It is easier for me also to do a preventive work rather than a
Hmm.
rehabilitative or a restorative work as well.
Absolutely, absolutely.
Yeah,
So I think what we can conclude with is that one, that it's important to see your dentist every 6 months. It's important to
yes,
have a good brushing routine.
yes.
It is also important to realize that prevention in this case also is better than
Yeah, it's
cure.
better than cure. Yeah,
Yeah, yeah. And it is important for children to start early with their dental hygiene.
yeah,
Yes. And
true.
also that for mothers, for expecting mothers, the second trimester is the best time to get treatment.
Yeah, second trimester is
Yeah.
the safest. Even X-rays can
It's
be
just
done during pregnancy. I think
the
there
second
was,
say.
yeah, even X-rays can be done. It's quite safe. Don't worry about it.
Okay.
Dentist would take care of that. Yeah,
Okay. Okay. So
great.
in during the second trimester, it's safe to basically go to the dentist, take medicines, get
Take
X-rays
medicine.
done, everything.
Yeah, yeah.
Which is
So
which is
for
a
X-rays,
relief because yeah,
huh,
yeah.
yeah.
Sorry.
So what
You were
happens
saying
is,
something. No? Hmm.
correct. So what happens is, for the X-rays, there are lead sheets which are there. So we
Hmm.
use those to prevent. any harm which may otherwise come. Usually there is no harm which comes in regular
Okay.
x-rays of dentistry, so not an issue.
Awesome, awesome. So, you've actually put our minds at rest, Dr. Chirag,
Yeah.
because there are so many questions that, I mean,
Yeah.
we go to the dentist when we do go, but, we don't have that much time to ask all of these. And you
Correct.
have really extensively answered all these questions.
Mm.
So, really,
I
thank you
hope I
very
was able
much.
to answer, because I am not sure if I was able to manage all the questions, but
I
yeah,
think you've answered most of the questions. Some of them were repeats, so we didn't even take them on.
right.
But I think we've answered most of their questions. So
Sure.
that's
Lovely
really
to.
good and extensively answered. I would say you've really answered in detail. So we've actually understood how it works. So thank you so much. Thank
Thank
you to
you so
Dr.
much for
Chirag.
having
Thank
me.
you to Royal Dental Clinics, and
Yes.
we will put details about Royal Dental Clinics in the comments so that everyone
Sure.
has all the details. Thank
Sure.
you so
Thank
much.
you.
It was a pleasure having you here, Dr. Chirag.
Pleasure. Pleasure was all mine. Thank you so much.
Thank you.